Welcome to part 2 of Adaptation to Pregnancy. This lecture is going to focus on the psychological adaptation. We will begin with maternal role transition. You can see the different stages that a woman must go through throughout pregnancy. In the first trimester, it is not unusual for a woman to feel ambivalent about getting pregnant or being pregnant, even if she was trying to conceive. Now it is real and not imagined. Therefore, a certain degree of anxiety occurs. Is this really the right time? Will I be a good mother? Should I have finished nursing school first? What will my partner think? What will my other children think? How am I going to take care of them and a new baby? She may not be happy about how she feels, especially if excessively tired or nauseated. And she still needs to complete all of her other responsibilities day in and day out. Some women may fear the physical changes associated with pregnancy, leading to our nursing diagnosis of disturbed body image. Early in pregnancy, she is in the seeking phase. She needs a safe environment for herself and her fetus. She selects a provider for prenatal care. She begins taking vitamins and gets advice from her family in regards to cultural practices to ensure a healthy pregnancy and baby. Now, some of these cultural practices may not be accepted in Western medicine. It is important to the pregnant woman that the father of the baby accepts the pregnancy. It is a relief, in fact. If not accepted, this creates anxiety as the pregnancy progresses. The woman worries, how can she make it on her own if he never accepts the pregnancy? How will this baby impact her life? She wonders how her other children will accept another child into the fold. In addition, many pregnant women seek acceptance from their own mothers. And if at any time there is anxiety that she is feeling from the father, the children, her family, her cortisol levels may increase. As the pregnancy continues, the pregnant woman begins to modify her own identity from wife or significant other, worker, housekeeper, mother of one to mother of multiple children. She learns to give of herself. There is less focus on her, and she begins to put more focus on the growing fetus, accepting and embracing the body images that occur, and realizing that this is necessary for good fetal growth. She commits to her unborn child by following the guidelines for prenatal care and making the necessary lifestyle modifications. She shares her baby's activity patterns and growth with others in conversation and in pictures, and some even share the ultrasound photos. Once the baby starts moving, there is more and more emotional bonding that takes place. This baby is real. It is also important that the family goes through the adaptation process, because they will be experiencing role changes also. The father of the baby may or may not be excited. There is a certain degree of worry related to the financial burdens of raising a child. He may feel insecure in his relationship and wonder where will he fit in once the baby is born and occupies the attention and time of his significant other. He is also concerned about the health and well-being of his partner, as well as the baby. He may be ambivalent, nervous, or afraid to participate in the birthing experience. It is important that we include the father in the prenatal office visits. He should be encouraged to attend the prenatal education classes with his partner. Some institutions provide special classes for fathers only. For example, St. Joseph Hospital in Orange and Mission Hospital have a Daddy Boot Camp, men only class, and this includes only male nursing students and sometimes even the nursing students can't attend. Other members of the family must adapt. Grandparents may or may not be happy about the pregnancy, especially if they are already caring for grandchildren, or they have concerns about the relationship between their daughter and her significant other. They may be concerned about how much they will be allowed to participate in the birthing experience. It is hard to predict how siblings of the new child will adapt when told of the pregnancy. Younger children, they don't really understand what it means to be pregnant. Even when the baby comes, a toddler may look at the mother and tell her to take the baby back because she doesn't understand that this is a part of the family. Older children are more capable of understanding what pregnancy in a new child means. However, the child may wonder, how will they fit in now that a new baby is in the picture? Some adolescents, while accepting of the pregnancy, may feel embarrassed to share the news with their friends, to be seen in public with their pregnant mother, because after all, if your mother is pregnant, it means she's having sex. Other issues affecting adaptation include being a teen, a single mother, repeated pregnancy loss, socioeconomic factors, and/or lifestyle problems such as being homeless, drug and alcohol use, or having no social support. All of these can actually create barriers to prenatal care. Some women have fear. How will the partner react when told of the pregnancy? Especially if this wasn't planned. If there is a history of recurrent pregnancy loss, will this pregnancy end the same? Therefore, if she doesn't get prenatal care, it's a means of denying that she's actually pregnant. Some women prefer getting advice received from others rather than from an obstetrician or a nurse practitioner. Organized medicine may go against cultural beliefs about pregnancy. Some women see pregnancy as a normal, healthy condition, which it is, but in so thinking, there's no need to have any type of Western medicine care. They may seek a lay midwife closer to the due date and decide to deliver at home. In early pregnancy, a woman may be ambivalent about continuing the pregnancy. In this case, there's no need for prenatal care if she decides to terminate. Many times at the first prenatal visit, a vaginal ultrasound is performed, and the provider is very excited to show this fetus to the pregnant woman. But if she's uncertain if she's going to continue the pregnancy, she doesn't want to see it because it makes that choice more difficult. Some adolescents or victims of domestic violence may deny or hide their pregnancy from others for fear of reaction by their parents, friends, teachers, or from the abuser. In fact, some of these women end up coming into the emergency room complaining of unexplained, relentless abdominal pain, only to find out that not only are they pregnant, but they are in active labor. And last but not least, uninsured women do not seek prenatal care due to the expense. The state of California has legislation that provides free prenatal care to the uninsured and low-income women. It is in the state's best interest to provide good prenatal care to improve pregnancy outcomes instead of having neonatal intensive care units full of babies that are preterm or have other problems because their mother didn't have the money or resources for prenatal care. This lecture discussed a few of the physical changes and a variety of the psychosocial adaptations that occur during pregnancy. It is important for the nurse to listen to and address a woman's concerns regarding the multitude of changes that occur during pregnancy. The nurse needs to support the pregnant woman during this transformation to motherhood. The nurse needs to recognize When a woman is not adapting to pregnancy as expected, you need to notify the obstetrician or nurse practitioner about what you've been told or what you've observed. In addition, the nurse should refer this patient to counseling, childbirth education, newborn care classes, and parenting classes that are offered within the community. Thank you for listening to the lecture on the physical and psychological adaptations required in pregnancy.